Good day, guys. I hope you guys are doing so fine. Okay, you guys are welcome to yet another YouTube series, and today we'll be talking about the vagus nerve. Okay, we're still talking about the cranial nerves, the various cranial nerves. We're making videos on each one of them, and today we'll be talking about the vagus nerve. Okay. So this is the MBBS Niger. If you haven't subscribed to our YouTube channel, kindly do subscribe to our YouTube channel. Like our videos, share our videos, and like our videos. Okay. So moving to the business of the day. What is the overview of the vagus nerve? The vagus nerve is the 10th cranial nerve. It is a functionally diverse nerve, offering many different modalities of innervation. Okay, it is associated with the derivation of the fourth and sixth pharyngeal arches. Has a sensory function. This innervates in the skin of the external acoustic meatus and the internal surfaces of the laryngeal, pharynx, and larynx. Okay, it provides visceral sensation to the heart and the abdominal viscera. All right, and special sensory. It provides taste sensation to the epiglottis and the root of the tongue. Motor. It provides a motor innervation to the majority of the muscles of the pharynx, and the soft palate, and the larynx. Parasympathetic function. It innervates the smooth muscles of the trachea, the bronchi, and the gastrointestinal tract, and regulates heart rhythm. All right, so what is the anatomical course of the vagus nerve? And the vagus nerve has the longest course of all the cranial nerves, extending from the head to the abdomen. It is so long, from the head to the abdomen. Its nerve is derived from the Latin word vagare, which means wandering in the head. The vagus nerve originates from the medulla of the brainstem. It exits the cranium via the jugular foramen with the glossopharyngeal and the accessory nerves, all right? And within the cranium and the auricular branches arise. This supplies sensation to the posterior part of the external auditory canal and external ear. The anatomical course of the vagus nerve in the head, in the neck. The vagus nerve passes into the carotid sheath, traveling inferiorly with the internal jugular vein and the common carotid artery. At the base of the neck, the right and left nerves have different pathways. The right vagus nerve passes anterior to the subclavian artery and posterior to the sternoclavicular joint, entering the thorax. The left vagus nerve passes inferiorly between the left common carotid and the left subclavian arteries, posterior to the sternoclavicular joint, entering the thorax. Still talking about the anatomical course of the vagus nerve. We say that several branches arise in the neck. We have the pharyngeal branch. We have the superior laryngeal nerve. We have the recurrent laryngeal nerve. Now you could see this picture here. It shows the vagus nerve. You see the superior laryngeal nerve. You see the several branches of the vagus nerve. All right. Now you could see that the vagus nerve originates from the head and right into the abdomen. It is so long. Okay. So still talking about the anatomical course of the vagus nerve in the thorax. And the right vagus nerve forms the posterior vagal trunk, and the left forms the anterior vagal trunk. And branches from the vagal trunks contribute to the formation of the esophageal plexus, which innervates the smooth muscles of the esophagus. And two other branches arise in the thorax. Left recurrent laryngeal nerve, it hooks under the arch of the aorta, ascending to innervate the majority of the intrinsic muscles of the larynx. Cardiac branches too. So, still talking about the anatomical course of the vagus nerve in the abdomen. And the vagal trunk enters the abdomen via the esophageal hiatus, an opening in the diaphragm. In the abdomen, the vagal trunk terminates by dividing into branches that supply the esophagus, stomach, and the small and large bowel. Okay. You could see that's the these are the various branches of the vagus nerve. Right. What are the sensory functions of the vagus nerve? And there are somatic and visceral components to the sensory function of the vagus nerve. Somatic refers to the sensation to the skin and muscles. This is provided by the auricular nerve, which innervates the skin of the posterior part of the external auditory canal and external ear. Visceral sensation is that from the organs of the body. Still talking about the sensory functions. And the vagus nerve innervates the laryngopharynx, that's via the internal laryngeal nerve, the superior aspect of the larynx above the vocal cords, and the heart too. It innervates the heart too, innervates the gastrointestinal tract up to the splenic flexure. What are the special sensory functions of the vagus nerve? The vagus nerve has a minor role in the taste sensation. It carries afferent fibers from the root of the tongue and epiglottis. This is not to be confused with the special sensation of the glossopharyngeal nerve, which provide taste and sensation for the posterior 1/3 of the tongue. Okay. Let's talk about the motor functions of the vagus nerve now. Innervates the majority of the muscles associated with pharynx and larynx. These muscles are responsible for the initiation of swallowing and phonation. Okay. And most of the muscles are innervated by pharyngeal branches of the vagus nerve. Superior, middle, inferior, pharyngeal, constrictor muscles, so on and so forth. You can see this picture right here. This picture is showing almost everything. Alright. And still talking about the motor function, is function to the larynx. Alright. Function to the larynx, function to external larynx, okay. Function to the cricothyroid muscles, right? And parasympathetic functions, right? In the thorax and abdomen, the vagus nerve is the main parasympathetic outflow to the heart and gastrointestinal organs. The cardiac branches arise in the thorax, conveying parasympathetic innervation of the sinoatrial and atrioventricular nodes of the heart. Okay. Parasympathetic function supplies the gastrointestinal system. The vagus nerve supplies provide parasympathetic innervation to the majority of the abdominal organs. It sends branches to the esophagus, stomach, and most of the intestinal tract to the splenic flexure of the large colon. The function of the vagus nerve is to stimulate smooth muscle contraction, so on. So cardiovascular. Many pharmacological agents can be used to potentiate vagal tone on the heart, therefore slowing the heart rate. Beta blockers and muscarinic. I think this is the clinical correlation to the vagus nerve. You could like pause this video and get to look at it. Okay. Lesions of the cranial nerve tone are rare. Lesions to the pharyngeal branches can lead to dysphagia. There's difficulty in swallowing and so on. Just pause this and get to look at it by yourself. Okay guys, with this we have come to the end of our tutorial on vagus nerve. Okay, I'd like you guys to share our YouTube channel, subscribe to our YouTube channel, like our videos, comment on our videos. Right, you could just come to our YouTube channel, watch as many videos as you can, all right, so that you could learn better. All right, so see you guys in the next tutorial, and bye for now guys.